Speaker is Dr. Peggy Honan, who leads the state, tribal, local, and territorial support task force in the CDC's COVID-19 response. Dr. Honan, whose bio says she lives in Atlanta with her husband, two children, and four Scottish terriers. Forgive me, Dr. Honan, but I had to throw that in because that's such a wonderful part of your ID. She will give.
So I think it may be confused with someone else's. I do have a wonderful Labradoodle, but I don't actually have a Scottish Terrier, and we just have
Okay.
one dog, so I'm not sure what wires got crossed.
Well,
That's me, Cindy Friedman.
But this is the icebreaker I was looking to make, and so thank you. But you will give us an overview of the pandemic. Next, we will hear from the owner of the four Scottish Terriers, Dr. Cindy Friedman, with the Division of Global Migration and Quarantine of the CDC, who will speak about protecting ourselves from the virus when we travel. Our third speaker is Dr. Jennifer Layden, Deputy Director, Office of Science at the CDC, who will update us on vaccinations. And our fourth speaker is Dr. Kevin Chatham-Stevens, Chief Medical Officer for the CDC's Vaccine Task Force and a pediatrician. This is a terrific lineup of speakers who will also be available for questions at the conclusion of the panel. Please enter your questions in the chat box. We would be grateful if the speakers would monitor and respond to questions in the chat during the briefing so we can be sure to answer as many questions as possible. We ask our speakers to speak slowly for our interpreters, who will simultaneously interpret in Spanish, Mandarin, and Korean. We will send a video of today's briefing and expanded bios of all our speakers following the briefing. Now I'm turning the conference over to our moderator and co-coordinator of these weekly briefings, Sunita Sarabji. Sunita, thank you.
Thank you, Sandy, and welcome to everyone who has joined the call today. I would like to start the call off today with a question to reporters. How many of you who have joined us for the past 18 months expected that we would still be having this conversation today? Use your reactions to raise your hand. I see a few. Let's get this started with Dr. Peggy Honan, who Sandy mentioned heads up the state, tribal, local, and territorial support task force at the CDC. Dr. Honan, welcome.
Yeah, thank you so much. I really appreciate the opportunity to join today and give a brief update on the state of the pandemic and some of what we're seeing most urgently today. So we have experienced a number of waves in this pandemic, and unfortunately, we're now in the midst of a fairly large surge that is related to a number of factors, including the Delta variant, which is a highly transmissible variant. In June, we had reached a low at one point of less than 12,000 cases a day being reported as a 7-day average. Right now, we're at nearly 150,000 cases a day being reported. So a pretty huge change over that time period. The average number of new hospital admissions is up over 12,000 right now. And we're having about 1,000 deaths a day reported to CDC from COVID-19. In total, there have been almost 640,000 deaths reported and nearly 40 million cases reported. So this pandemic continues to take a major toll despite the availability of proven mitigation measures and very effective vaccines. So we are seeing increases in cases, increasing emergency department visits, increasing hospital admissions, and increasing deaths. I want to mention briefly some numbers on vaccination, although my colleague, Dr. Jen Layden, is going to go into that in more detail. But to say overall, we're just under 53% of the US population overall that's now fully vaccinated. And that ranges from a high of almost 82% of those that are 65 years or older being fully vaccinated, down to about 40% of those who are 12 to 17 years. But there's also a lot of variation by geography. So if we look just at the adolescents from age 12 to 17, while the national average for being fully vaccinated is about 40%, that ranges from a low of about 11% in Mississippi up to a high of about 60% in Vermont. So through this surge over the summer, particularly in July and August, we've been tracking all of the cases, emergency department visits, and hospitalizations, but are particularly concerned about children and looking at the burden on children of this disease. And we are seeing, similar to what we're seeing for the whole population, increasing proportion of emergency department visits in children that are COVID-19 related during this time, increasing new hospital admissions. And importantly, we can divide the states up by vaccination coverage level and see some important trends where those states that have the highest levels of vaccination coverage have the lower rates of emergency department visits and hospitalizations in children. And conversely, the states that have the lowest vaccination coverage have seen the greatest increases in emergency department visits and hospitalizations in children. And I bring this up because it really emphasizes the role that the community can play in protecting children. So there is no vaccine authorized for children under 12 right now, but we can all do our part to protect children by vaccinating as many people as possible that are age 12 and over, and using other mitigation strategies like wearing masks to reduce transmission. So through those efforts, we can really protect children, even now before there's a vaccine available for them. I also want to bring up schools. You know, here in Georgia, schools opened about a month ago in most counties, but over the coming weeks, schools will be open across the nation as they're opening in more and more places every day. And I think the great news from last year during the 2020-2021 school year is that we can prevent transmission in schools with comprehensive layered prevention approaches. So not using one type of prevention, but using many types of prevention, which include, promoting vaccination, using face masks for everyone, universal masking consistently and correctly, physical distancing, using screening testing as a way to identify cases so that they can be isolated quickly, improving ventilation, and then doing some of the basic things that we know prevent disease transmission for lots of infectious diseases like hand washing, staying home when you're sick, etc. So we need to do a better job of all of that to keep disease rates low and keep our schools open for in-person education, because it has become even clearer over the last year how important schools are, not just for education, but for the overall mental and physical health of our children. So it's easy for transmission to occur when we let our guard down and decrease any of those prevention measures. It does take a concerted effort, and you've seen some recent reports of what can happen when there are gaps in that prevention. So just want to end today with a plea to everyone to work together to implement those prevention activities across the community so that we can reduce community transmission and also make sure that we can keep our schools safe and open for our children. So I'll be happy to take questions, but for now, I want to pass it back to you, Sanita.
Thank you so much, Dr. Honan. I have a question for you to kick this off. Could you talk a bit about vaccine equity? You mentioned that 53% of the population is fully vaccinated. Does that cut across all communities, or are there disparities in vaccination distribution?
I'll start, and my colleague, Dr. Layden, may want to add to this, but we certainly see some disparities in vaccination, but I want to highlight that we've made some really important progress in vaccine equity over the last 8 months or so. So in the initial rollout, we were seeing larger gaps in the equity of distribution, and there have been very concerted efforts that have narrowed those gaps and removed access barriers and tried to find ways to reach communities that might have lower levels of access. So we're certainly seeing a narrowing of those disparities for vaccine equity. Dr. Layden?
Yeah, hi everyone, Jen Layden here, one of the co-leads for the vaccine task force. Maybe the only thing to add to what Dr. Houdin already mentioned was certainly there have been disparities. We've seen improvement in some of those disparities. But when we talk about differences in vaccine administration rates, it's very different in each community and in each population. What is the population that has lower rates may differ in one state or one county compared to other areas. So it's very hard to provide a large overview of the disparities. It's helpful in looking at that to look at more of a community level.
Thank you, Dr. Layden. Sandy just mentioned that we will take questions, all questions at the end of all three speakers' remarks. So we move then to Dr. Cindy Friedman. She's the division head of the Global Migration and Quarantine Force at the CDC. Dr. Friedman, welcome.
Good afternoon, everyone. My name is Dr. Cindy Friedman, and I'm actually the chief of the Travelers Health Branch at CDC in the Division of Global Migration and Quarantine.
Thank you for clarifying.
That's okay. And we provide, in the Travelers Health Branch, we provide updated travel information to travelers and others clinicians who are interested in improving the health of travelers. Our travel health notices are used to alert travelers and other audiences to health threats around the world, and we advise them how to protect themselves. But I would say that during the pandemic, our work has centered on helping travelers understand the global COVID-19 risk in destinations, and then developing domestic and international travel recommendations. So I'm here today to answer questions, but if you remember only one thing today, it should be that everyone who is eligible should get fully vaccinated for COVID-19 before they travel. Because of the Delta variant, this Labor Day weekend, vaccinated people who travel still need to take precautions, as Dr. Houdin pointed out, such as masking and social distancing. So I'm going to keep my remarks brief, and I'll be available to take questions after the next speaker. Thanks.
Thank you, Dr. Friedman. We move on to Dr. Jennifer Layden, who you just heard from. Dr. Layden.
Great, thanks, and hello, everyone. As I mentioned, I'm helping to lead CDC's vaccine task force. Before we get to some of the questions you may have, I would like to review some vaccine-related news that has happened since our last briefing. First, in mid-August, CDC recommended that people with moderately to severely compromised immune systems receive an additional dose of an mRNA COVID-19 vaccine at least 28 days after a second dose of either of the mRNA vaccines. We know that people with moderately to severely compromised immune systems are especially vulnerable to COVID-19, and that they may not build the same level of immunity to the 2-dose vaccine series compared to people who are not immunocompromised. CDC's recommendation for these individuals is intended to improve immunocompromised people's response to their initial vaccine series. Recently, HHS announced a plan to begin offering COVID-19 vaccine booster shots this fall. As we have done throughout the pandemic, and as it relates to COVID-19 vaccine, this is subject to authorization by the U.S. Food and Drug Administration, as well as recommendations by CDC's Advisory Committee on Immunization Practices, often referred to as ACIP. FDA is conducting an independent evaluation to determine the safety and effectiveness of a booster dose of the mRNA vaccines, and ACIP will decide whether to issue a booster dose recommendation based on a thorough review of the evidence. The COVID-19 vaccines authorized in the United States continue to be highly effective in reducing risk of severe disease, hospitalization, and death, even against the widely circulating Delta variant. However, as Dr. Honain alluded to, COVID-19 constantly evolves. Experts at CDC are looking at all available data to understand how well the vaccines are working, including against new variants like Delta, and how what the vaccine effectiveness is against this virus. We recently released data on vaccine effectiveness in essential frontline workers, including healthcare personnel, before and during the emergence of the Delta variant. This data showed that the risk of COVID-19 infection remained low for workers who received a COVID-19 vaccine. The estimated effectiveness of COVID-19 vaccines against any infection, whether symptomatic or asymptomatic, declined from 91% to 66% once the Delta variant became predominant. However, the vaccine still provided strong protections for the workers. As I mentioned before, COVID-19 vaccines continue to work and are safe and effective. And we'd be happy now to take your questions. Thank you.
Thank you so much, Dr. Layden. Appreciate your remarks. Our first question comes from Joseph Orozco. Joseph.
Yes, my question was regarding the exposure rate of, I had heard that the Delta variant is more contagious. And so the warning was keep your exposure rate lower. And the COVID-19, it was saying, watch beyond 15 minutes. You can be in a group for 15 minutes, even masked or unmasked, if you have vaccinations. I'm just trying to get that straight in my head. What is the exposure rate? Should we, because the Delta is more contagious, should we have less exposure, stay away from crowds? I'm just looking for some advice from CDC. Thank you.
Yeah, this is Peggy Honain. I'm happy to start, and my colleagues may want to add something. We have seen clear evidence that the Delta variant is highly transmissible. And there are papers suggesting each person who is infected is likely to transmit to more people than was the case with earlier variants. What we have seen so far continues to suggest that the same prevention strategies will be effective, meaning universal masking, keeping as much physical distance as possible, improving ventilation, screening testing in high density places, which could be congregate living settings or places like schools where people might be very close together and in crowded settings. But it does mean we need to think carefully, particularly about indoor public places where there could be crowding, and particularly in communities that have high levels of transmission. So there is now a county checker up on the CDC website where you can put in your state and county name and see the level of transmission in your county. And that gets updated every day. And that can be a really useful tool. Right now, most counties in the US are in high levels of transmission, but we really sincerely hope that will begin to come down soon. And then there's an opportunity for people to closely track their community and know when they need to exercise the most caution. I will say it's important for you to really stay diligent in your prevention, because when we get the rates low, we want to keep them low. So we don't want to have more waves of this pandemic. And these prevention efforts are ways that we can help keep it low. The other is to encourage people in the community to get the information they need so that they're ready to be vaccinated, because the real key to ending this pandemic is increasing our population vaccination rates.
Thank you. And before we move on to the next question, I would just like to introduce Dr. Kevin Chatham-Stevens. He's the Chief Medical Officer for the CDC Vaccine Task Force and a pediatrician. He is here to answer any questions you all might have. He's not going to be providing remarks. So we move on to questions. Next is Carlos Matias, who is joining us from Spain for this briefing to report for one of Spain's leading newspapers. Carlos, welcome. Please ask your questions.
Thank you very much. What is the situation in the state of Alaska?
So right now, I think many of the areas of Alaska are also experiencing high levels of transmission. The communities in Alaska, many of them are have limited access and are really what we would refer to as frontier communities. So finding ways to best support the communities is important. There was a recent MMWR report that really showed the value of distributing point of care testing in some of these remote communities so that people who were infected could rapidly be identified and isolated to break the transmission there. Cindy, I don't know if there's anything you'd want to add from a travel perspective on Alaska?
No, I don't have anything particular for travel advice for Alaska. I mean, we do have domestic travel guidance, and so I can go over that. And that is, you should be fully vaccinated before you travel domestically. And if you are vaccinated, you don't need to get tested before or after travel or self-quarantine. Now, each state and local government may have their own recommendations or requirements. So folks who are traveling to the United States and plan to visit different states need to know what the local and state requirements are. It's best to be vaccinated. Coming into the United States, there is a global testing order which mandates that you show that you have a negative COVID test when you're traveling by air within 3 days of departure, and unless you show proof of recent recovery. So there are guidelines, and those are on our webpage for travelers coming to the United States.
Thank you. Our next question comes from Henrietta Burrows. Henrietta.
Thanks so much, Sunita. My question involves two issues. One, the question of equity, or at least the principle of equity. And number two, where some of the variants are originating. For example, the Delta variant supposedly originated in India, and there's another variant coming out of South Africa. So some people are proposing that instead of giving Americans booster shots, that the vaccine be distributed to other countries. In that way, protecting people in other countries, Americans who might be traveling, and boosting vaccination rates worldwide. So what position do you have on the issue of equity and the issue of just distributing, not giving Americans booster shots, but giving the vaccines to other countries?
Yeah, thank you for that question. So the US is very committed to both working towards health equity domestically and globally, and is very engaged through our international task force and our connections to other international health groups, and working to provide vaccines and other technical assistance to a number of countries to help increase the vaccination rates globally. Simultaneously, we are very closely tracking the data, as Dr. Layden shared, and watching the data here within the US to understand what might be needed to best protect the population in the US. So I don't see it as an either or proposition, but really we're doing both protecting the population domestically and hopefully serving as a good partner globally, because we do understand that this is a global pandemic and that the way to decrease the emergence of new variants of concern is to decrease transmission globally. So it's a concerted effort on both fronts. And I just want to turn and see if any of my CDC colleagues want to add anything to that.
Dr.
No,
Chatham, oh, please go on.
No, I was going to say, nothing to add.
Dr. Chatham-Stevens, do you have anything to add to Dr. Honane's remarks?
Nothing to add at this time. Thank you.
Okay, and we will move on then to Khalil Abdullah. Khalil.
So given, there's a lot of statistical analysis of the spreads and all of that, if you have a population, a sector of the population that is not getting vaccinated, even if you develop a vaccine for children, why would we expect that their children are going to get vaccinated? So I'm wondering if you have some projections on that front. Thank you.
So, within the US, there's a lot of diversity of opinions and viewpoints on vaccinations, and it ranges from people who were very eager and lining up and trying to get to the front of the line in December and January from the vaccines when they first came out, to people that have some hesitancy and want more information. And then at the other end, there are people that feel pretty firmly that they, based on what they know right now, at least, they don't want vaccination. But we do have that spectrum of opinions, and we are continually working to get good information to people so they can make the best decisions for themselves and for their families. And we certainly see people's opinions on this can change over time. And people that maybe had some hesitancy and were concerned about vaccines being available under emergency use authorizations, they've now watched the data accumulate. Some people saw the full approval by FDA and thought it was enough to convince them that it was important. So I don't see it as people necessarily being in one mindset where they will never change, but hopefully people continuing to receive information, understand the benefits to themselves and their families. And it's possible that some people who might have been hesitant as adults will actually be more likely to get vaccinated when the whole family can get vaccinated. So it's a lot of diversity in how people look at this. And we're just going to continue from a public health perspective to provide the best information possible to inform those decisions. Dr. Layden?
Yeah, nothing to add to that. Thank you.
Dr. Friedman or Dr. Chatham-Stevens, anything to add?
No, nothing to add from me.
Okay.
Nothing either. Thanks.
All right. We move on to Hassan Abbas. Hassan, could you state the reporters, as I call on you, could you please state the outlet that you are reporting for? Thank you.
Hello. Hi.
Hassan.
Hi, I write for the Arab American News in Dearborn. And my question is to any of the experts on the call today. Some have felt that over time, and I've certainly had to follow a lot of the coverage on COVID-19 and the CDC and the federal government, that the CDC has shifted its position on masking, mandates in schools, social distancing, or the exact distance that is required in classrooms for classrooms to be safe. Sometimes the CDC has shifted its position from mandating to recommendations. We've certainly seen a patchwork in local school districts and counties as well, especially here in Michigan. So I suppose my question is there definitive science now with accumulation of a year's worth of data about community spread, about schools, where the CDC can confidently say that masking in schools should be an absolute requirement to keep kids safe, to keep families safe, and to stop the spread, if that makes any sense?
Yeah, thank you so much for that question. So, schools and decisions about schools tend to be made at the district level. So these represent very local decisions, and CDC is in the position of trying to provide the best public health information for those local decisions to be made. We have tried consistently to emphasize that to keep schools safe, we need low community transmission, and it really is a community-wide decision to prioritize schools and to make sure that schools will be the last thing to close and the first thing to open, that is our priority, even if other things have to be postponed, that we're working together to keep schools as safe as possible. Our recommendations are that there is universal masking in schools. That means all teachers, staff, students, visitors, regardless of vaccination status, wear masks in schools. And as all of you likely know, there have been different scientific facts at different points in this pandemic because we're learning really quickly. So last spring, at one point, the data was suggesting that fully vaccinated people had a low risk of transmitting the virus and a low risk of being infected. As the data has evolved, we got more concerned about this with the Delta variant. And so this is why CDC, when the science changes and when the data changes, we update our guidance to recommend that everyone wear masks in indoor public spaces, both vaccinated and unvaccinated. But there is a lot of consistency in our message to schools, which is you need these multiple layers of prevention. We recommend universal masking. We recommend the most distance possible. We recognize that every school building is different. So rather than saying you have to be 6 feet apart or we want children to stay home, we want the most distance possible while still keeping kids in person in class. And then other recommendations like improving the ventilation and screening testing can add protection there. So really encourage local communities as they make these local decisions to put public health and their children as the top priority to prevent transmission in the schools. Kevin, anything you'd want to add?
I don't think so. Well said. Thank you.
Any of the other speakers? Anything to add? All right, we move on to Mei Shen of the World Journal. Mei, please ask your question.
Hello. Yes. Yeah, I would like to know, I think there are cases of the breakthrough of the fully vaccinated people. I would like to know what's the percentage of the breakthrough rate as of now. And also would like to know if the booster shot is necessary to reduce the breakthrough, or what's the current situation?
I can start and turn to Dr. Layden to add to this. So there's not one single answer to that because it varies by the proportion of the population that is vaccinated. If 100% of a population was vaccinated, then every case that happened would be in a vaccinated person, even though the number of cases would be quite small. So it's not a single answer. What I can say clearly, though, is that the risk of being infected is much higher among the unvaccinated than the vaccinated. And the differences get even larger when we look at hospitalizations and deaths. So we're still seeing very strong protection and effectiveness of the vaccine against these severe outcomes. Dr. Layden?
Yeah, thanks for that. Just a couple things to add. Agree, when we talk about breakthroughs, it's really important to think of it as the risk and what the benefit of the vaccine provides. We still see that someone who has been vaccinated has a much lower risk of hospitalization and severe death. And that is our most effective strategy to reduce severe outcomes from COVID-19 infection. Recently, as we mentioned earlier, we did release, ACIP made recommendations that people who are immunocompromised receive an additional dose of an mRNA vaccine. And that recommendation was made because there was growing evidence that individuals who are immunocompromised, one, may not be responding as well as others to the initial series, and two, there was some evidence to suggest that they could benefit, there may be some benefit to an additional dose for these individuals. With regards to boosters for a broader population or the general public, the data is still emerging on that, and both FDA and ACIP and experts are reviewing that data as it comes in to determine if there's a benefit of receiving an additional dose or a booster dose, as well as what that risk may be to receiving that. And we'll see additional recommendations in coming months as the science evolves on that.
Dr. Layden, I'd like to ask a question. There's different data out there on the percentage of new infections that are in fully vaccinated people. Could you share some information about that? And how concerned do we need to be about these breakthrough infections?
So I can add briefly, I don't have the numbers right at my fingertips, but certainly something that Dr. Honain alluded to is the higher fraction of individuals are vaccinated in our community. We will see a higher number of cases of COVID-19 of individuals who had a vaccine. What we are seeing is that generally those infections are more mild, and still the highest fraction of individuals who are hospitalized or have severe outcomes from COVID-19 are occurring among those who were unvaccinated or had not been vaccinated prior to their infection.
And I think the one thing I'd want to add there is, we tend to look at it this way, like how many out of the cases, how many were vaccinated, how many weren't. I think the other frame that is really useful to look at is out of everyone who's vaccinated, what is their risk of getting infected, which is a very small risk. And so when you look at the, what are we at, over 200 million vaccinated with at least one dose, it's really an exceedingly small percentage that will have infections, and certainly an even smaller percentage that will have severe infections that result in hospitalization or death. So really understand why people are concerned, but want to emphasize the value of this vaccine in ending the pandemic and reducing the risk of infection, hospitalization, and death.
Thank you so much, Dr. Honain. We go next to Mohsin Zahir. Mohsin, please ask your question and state your news organization.
Thank you very much. My name is Mohsin. I'm from Urdu News. So my question is, I have two questions. A recent University of Washington model said it is possible another 100,000 people could die from COVID-19 by December. And according to Dr. Fauci, this terrifying forecast could be prevented if more Americans get vaccinated. So what do you forecast? This number is very horrible, 100,000 people in the next few months, So, and second is in New York, the positivity rate is more than 3.31%, and parents have concern that positive rates is going up and up day by day, and children are going to school. So what do you how do you address the concerns of the parents who are worried about this upgoing positivity rate in New York State?
Yeah, thank you very much for those questions. So, I have also looked at those models, and CDC is working with a large group of modelers to do forecasts of what can happen under different scenarios. And I think what is important is some of this is within our control. We can increase vaccination coverage, we can increase masking, we can increase distancing, we can improve ventilation, we can, stay home when we're sick so we don't go places when we have symptoms and are not feeling well that could spread the disease. And all of these are important both for COVID, but also for other diseases as we head into the fall and winter. We are getting close to influenza season where there could be a lot of transmission of influenza. So we need both to increase COVID-19 vaccination, we need to have high coverage with influenza vaccination, and then we need to practice these community strategies that can reduce the risk of transmission, because I don't want to see another 100,000 deaths in this country, and I don't want to see many, many deaths globally. It's a tragedy, and we have the ability to reduce the rate of these deaths and decrease the overall impact.
Thank you. Do any of the other speakers want to respond to that question? Okay, we move on to Edwin Okongo of Mashale News. Edwin, would you ask your question?
Hello, Anita, good to see you.
Good to see you too.
Oh, yeah. Well, a few months ago, during a briefing for Muslim American healthcare workers, Dr. Fauci said that we should be careful not to lump together all the people who are hesitant to get vaccinated as conspiracy theorists. He gave an example of African Americans who have genuine concerns because they've been used as guinea pigs in the past. So what is the CDC doing to make that distinction and reassure people who have those concerns?
Terrific question.
Could you just repeat the last part? I didn't, the last part of the question, it faded out to me.
I think Edwin is asking about the demonization of African Americans as vaccine hesitant. Could you address that?
Sure, I can start and others can weigh in. So a very important focus of the work to address inequities and disparities in vaccine administration, as well as other aspects of the COVID-19 response. We do have a vaccine equity group and team that's working collaboratively with our state and local partners, as well as community organizations, to promote awareness, provide trusted information, and to try to build confidence in the safety and effectiveness of the COVID-19 vaccine.
Yeah, and I would just add, it's really important that we all try and work together to provide accurate, fact-based information so that people can weigh the information and make the best decision for themselves and for their families. So it's unfortunate that a lot of the vaccine discussion gets polarized into very different views, when in fact what we need is just good science-based information addressing the questions that people have, letting them think about the answers, and hopefully reach a really positive decision to keep their family safe. So I don't think there's any benefit from coming at vaccine hesitancy or concerns with anger. The answer is really providing information that people need so that they can make good decisions.
Thank you. Would any of the other speakers like to weigh in? All right, we next move on to Araceli Martinez. Araceli.
Hello, Sunita.
Hello, how are you?
I'm good. Thank you for the opportunity. Well, I'm trying to see if the doctors can tell us what is the difference between last year and this year, putting aside the vaccine, because we continue seeing a lot of people that is dying, so, and going to the hospital, and it's weird, but I still hear people that said, oh, I didn't believe in COVID, but I'm now in the hospital. And I was so scared because I did a story about a registered nurse from Kaiser that she passed away. She was unvaccinated. And how can our people in the hospitals are not vaccinated? So I would like to see if you can address these issues that we are confronting.
Araceli is from La Opinion.
Oh, yeah, sorry about that, Araceli.
No worries. Thank you.
Thank you. I do think it's exceptionally difficult to answer the question without mentioning vaccine, because vaccine is one of the big changes from last year. So I think most of us from the CDC that are on the call with you have been doing this for a long time. And I will say last summer when we saw, well, last spring and last summer in 2020, when we saw large waves of COVID-19, we had very limited tools to address it with. At the very beginning, we didn't have data on the effectiveness of the prevention measures, but that has really grown over time and has been very reassuring to see how effective face masks can be, distancing can be, testing. We have a lot more testing capacity than we had before. So these tools have helped us. One of the hardest points, I think, was in December and January when we were at such high rates of disease, and we initially had not enough vaccine for everybody who wanted it. So we were very careful in trying to make sure vaccine was distributed first to the people that were at the highest risk of dying, and really tried to prevent the maximum number of deaths through distribution. The great news now is we have enough vaccine for everyone to be protected. And so we really just need to provide fact-based information to help dispel some of the myths that have been circulating and some of the misinformation that can harm people's health. So I think both using the community mitigation strategies that we know work and increasing vaccination coverage can help us take a step forward and I hope not have another spike or surge of cases. That's the goal. We don't want another wave of cases. We want to be able to reduce community transmission and keep people safe and have as few of deaths possible.
Do any of the other speakers want to address Araceli's question?
Nothing additional.
Okay, we move on to Carmen Rodriguez. Carmen. All right, well, Sandy Close has a question for Dr. Friedman. Sandy, please ask your questions.
Thank you. I am supposed to get on a plane. I haven't been on a plane except for one brief travel up to Northern California a couple of weeks ago. I haven't been on a plane since before the pandemic, and I'm really nervous. The plane will take me to the East Coast, so it's a 5 or 6 hour flight. What is really the recommendation as people think about getting on planes for Labor Day and for the accelerating work week? What really are your tips for traveling on a plane? Or would you just say, steer clear? If you're older and wiser than the rest of us, don't risk it.
Thanks for that great question. So I want to start with your first comment that you're going on a plane and you haven't been on a plane for the whole pandemic. And I think two things. One, I'm hoping that you're vaccinated, because I want to tell everyone that if they're getting vaccinated, no matter what their health status or their age, they should be vaccinated before they travel. So we've covered that. That's probably the number one thing. Also, there is a regulation that you must wear a mask when you're traveling on public transportation within the United States and going out of the United States. And just in terms of air travel, you know, most viruses and other germs don't really spread easily on flights because of how the air circulates and how it's filtered on planes. But air travel, as you know, requires a lot of time in security lines and airport terminals in crowded spaces. So that brings you into close contact with other people. So keeping your distance is hard when you're traveling. So that's why there are these layered approaches to air travel for you. So get vaccinated, wear a mask, and that those are the types of advice for air travel. And so for people who are not vaccinated for this Labor Day weekend, you know, we would recommend waiting. Go get vaccinated over Labor Day weekend and then plan your trip for Thanksgiving. You know, so you can keep your family safer, the people that you're going to visit. When you gather with other people, you know, we have to all protect those who are vulnerable. So if you're going to visit with people who are unvaccinated, that's another issue. So I would say the number one thing for folks this weekend is if you have to travel, you know, wear your mask. As we mentioned before, that because of Delta variant in places with high transmission, which is a lot of the United States right now, you need to wear a mask when you're in indoor public spaces, even if you're vaccinated. And then if you're not vaccinated, get vaccinated so you can have a nice vacation coming up in the holiday season.
Dr. Friedman, could I follow up with a question for you? So we know that there are several types of masks that are available to all of us, and people have talked about the inefficacy of a single cloth mask. Could you talk a little bit about that in terms of air travel? What should we be wearing?
Right, so there are many, I'm just making sure I'm still off mute. There are many types of masks you can use to protect yourself and others from getting and spreading COVID-19. So the first thing is to choose, when you choose a mask, choose one that fits properly and snugly. But for cloth masks, you should wear one that has multiple layers of tightly woven, breathable fabric. And a nose wire is also helpful to help it fit snugly. And then don't wear masks with the exhalation valves or a single layer mask of a thin fabric. I'll turn it over to my colleagues who may have more information on masking, but I think those are the basics, you know, a good fit and no thin layered masks. Peggy, do you have other things you want to add to that?
I think you covered it well. I would just add that it's important that the mask fit well and be comfortable so you keep it on. And one of the challenges we have with masking is people taking them on and off. And we often hear of people following good prevention, having a mask, except they took it off and had a pizza party with 3 friends, and that's when transmission happens. So just thinking about ways that you can keep it on comfortably so that you don't let your guard down and expose yourself. And travel, as Dr. Friedman mentioned, is one of those times when there are a lot of close contact opportunities. So you want to be very cautious there and wear something that you're going to be able to comfortably wear for those 5-6 hours or 7 or 8 hours by the time you're in the airport and on the plane.
Any of the other speakers want to respond? All right, we will go to our last question from Peter White, and then I have a question for all speakers to end this briefing. Peter.
Hi, everybody. Thanks for doing this. You know, the COVID, it's more infectious, it's spreading really fast and everything. It seems like, how would you respond to somebody? I have friends who are still not vaccinated, and they're saying, see, it's just like it was before, you know, back in the spring when it was high. Now it's high again. What would you say about that? And is it likely that maybe it will evolve into something like the common flu and, you know, be less deadly, but it'll be around every year and we'll have to get a shot every year. Is that a likely expectation? Thank you. Oh, Tennessee Tribune.
Thank you, Peter.
Thanks. You know, I don't have a crystal ball to predict the future here, but I can say right now there's a big difference from the wave that we saw in December and January, and that is that it's hitting very disproportionately depending on vaccination coverage and the vaccination status of the individual. So while the rates are very high right now, they are much, much higher among the unvaccinated than among the vaccinated, and they are much higher in the counties and states with low vaccination coverage than in the counties and states with high vaccination coverage. So it's pretty compelling evidence that we can make a difference by increasing vaccination coverage as a community, and we can make a difference for ourselves by making sure we get vaccinated at the first opportunity so that we are as protected as possible. So there is a lot that we will learn over time about what the future of COVID holds for us, but we have good scientific data to support getting vaccinated now as soon as possible if you're not already vaccinated, and to try and help make a difference in another person. So when you have friends that aren't vaccinated, kindly sharing information, offering to help them make appointments, offering to drive them to get their vaccine, any way that you can reduce barriers to help them get vaccinated and be protected.
Thank you so much. I'd like to end the briefing by asking each of the speakers, as well as Dr. Kevin Chatham-Stevens, about what we as media reporters, what should we be paying most attention to as we try to keep our audiences engaged and up to date about the pandemic, given that we are now 18 months into this. Dr. Honen, would you like to start?
Be happy to start and then turn to my colleagues. So really appreciate all of the media's efforts to make sure that things are carefully fact-checked and conveying as accurate information as possible. And I think also helping us as you write things by thinking through how people might misinterpret things. Even if they're accurate, is there a way that someone will read that and take the wrong message from it because it's confusing? So just ask your help and clear communication, ask your feedback when you see things we're doing that are making it unclear to people. We want to make sure we're giving people the facts as they exist and as clear of information as possible. So really appreciate all of your efforts to help communicate this clearly. And I just want to point out, Kristen just put in the chat some nice information about reports coming tomorrow. These are really important, and just ask your help in disseminating that information.
Thank you. Dr. Friedman.
Thanks. I think I just want to really reiterate that please check for travel health notice and travel guidance if you're going international. It's really important to check with the destination what the situation of COVID is in the international destination. Even for domestic travel, check with the state and local place where you're going. So if, this is to you, reporters, please, let your readers know. And I think the overarching message that I started with was that if you could remember one thing to tell your readers today, that anyone who's eligible to be vaccinated should get fully vaccinated before they travel. And maybe they could plan ahead for the next holiday. I know we're right at Labor Day, so it's a little hard to get vaccinated for this weekend, but maybe that could be a Labor Day activity, and plan ahead for Thanksgiving and Christmas by getting vaccinated. Thanks.
Thank you. Dr. Layden.
Yeah, just want to start out by thanking you for being a critical partner to help share timely, important, and accurate information. Echoing what Dr. Honen said, the importance of the source of information and using accurate information, and then disseminating that and sharing it with the communities in your audiences in channels and means in which it's most effective to reach them. Thanks for your partnership. And one other thing maybe to point out is we have done a lot of work on vaccine confidence We have a toolkit on our website that provides information on how to share information with individuals who are vaccine hesitant. So for communications and efforts and conversations, that information can be really helpful.
Thank you. And we just have time for Dr. Chatham-Stevens' response.
Hey, thanks so much. I think as a pediatrician and a parent of school-aged children, I'm a little biased here, but just doing whatever you can to continue to communicate on how we can keep our kids as safe as possible, especially those who are under 12 and are not yet eligible themselves to get the vaccine. I think that would be a continued fantastic addition. Thank you.
Thank you so much to all our speakers and reporters today. Take care.
Thank you.
Thank you.